This is Radio Health Journal. I'm Reed Pence. This week, how having a genetic mutation affects your chances of getting life insurance.
They're denied a policy altogether, or they're charged higher rates.
Genetic information and fairness when Radio Health Journal returns.
I'm Nancy Benson, host of Radio Health Journal. If you enjoy listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
If you speak to some of the young protesters on the streets, they even say they're willing to die for them.
The ongoing fight for democracy in Hong Kong. Then,
I always found the first foods, like the first oyster or the first person to drink milk, kind of the strangest.
The questions you never knew you had. I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Viewpoints on your favorite radio station and subscribe and listen to shows anytime on Apple Podcasts and Google Play.
Genetic testing has been around for about 20 years, and if you're one of the millions who've taken a test, you may have found some ancestors. Or you may have discovered you carry a genetic mutation, putting you at a higher risk for cancer or other life-threatening diseases. Back in 2008, Congress passed the Genetic Information Non-Discrimination Act, known as GINA, to protect people against unfair discrimination based on our DNA. Let's say you have the genetic mutation BRCA2 that puts you at a higher risk for breast cancer. Thanks to GINA, your employer and healthcare provider can't jack up your premiums or deny you coverage based on that. But that's health insurance. Life insurance is a completely different matter.
Legally, life insurers are allowed to take into account genetic information. There's the federal law in this area called the Genetic Information Non-Discrimination Act prohibits health insurers and some employers from taking into account genetic information, but it doesn't cover other insurers. So legally, they can.
That's Anya Prince, Associate Professor of Law at the University of Iowa.
So those insurers, what they do for risk classification is they say, what is your risk of the thing that we're insuring happening? Right? What is the risk that you'll have damage to your home if you're a homeowner? Or what is a risk that you'll die if we're getting life insurance? So they take all of the information about you that they ask about, right? So what's your current health status? Can we have access to your medical records? Have you had any operations? All sorts of things. And they figure out what your risk level is. And then they can do one of two things. They can either say, you are too risky, we're not going to insure you, right? We're not going to offer you a policy. Or they can say, we're willing to take on that risk, and we're going to charge you a premium that is, matches what your risk level is.
Let's say you're super healthy and your family history shows little risk of life-threatening disease. You'll probably get a very low premium. The insurance company figures you're a good risk, and they'll be able to collect premiums from you for many years before you die.
When an individual goes to buy, say, $1 million of life insurance coverage, and let's say there's a whole pool of individuals that all want $1 million worth of life insurance, the life insurance company needs to know when it's going to have to pay out those $1 million claims, because typically in these whole life policies, they are going to pay. They pay when the individual dies, maybe when they reach age 100, but they're going to have to then charge a rate that's adequate to collect enough money over the lifetime of the individual so that they've accumulated enough to pay the $1 million claims.
That's Patricia Bourne, professor and Payne H. and Charlotte Hodges Midyett Eminent Scholar in Risk Management and Insurance at Florida State University. She says the underwriter has to make a best guesstimate as to whether the individual is going to live another 5 years or 40 years.
The individual that only has an estimated 5-year lifespan, that's really not a sufficient amount of time to collect from an individual something close to $1 million to pay that benefit in the future. So typically we don't see people who are really old being able to even qualify for life insurance. But if you're 30 or 40 years old and you're looking to buy life insurance, and the life insurance company estimates that you'll be around for 50 or 60 more years, then they can do a calculation to look at how much would we have to collect and how much can we collect and earn interest on over your lifespan, so that we're, with the greatest probability, able to pay your beneficiaries the $1 million or the face value that you want.
And because life insurers have access to your medical records, they can see if you have a genetic marker that puts you at risk for colon or ovarian cancer, for example. Depending on the company, they might increase your premiums as much as 3 times the average rate, or even deny you coverage altogether. It's perfectly legal, although some states are trying to extend the ban on genetic information to include life insurance.
Many states put language into their statutes pertaining to genetic testing for health insurance. And in Florida, there are some individuals that started to get concerned, the legislature and some of the public interest groups concerned that we needed to make the same protections available for people buying life insurance, and wanted to add the language to the statute that says they can't use the genetic information for health. They just wanted to add life insurance to that act, or to the language in the statute, using kind of the same arguments that people might be then discriminated against in purchasing life insurance companies who might not sell them coverage.
Most of the people we serve have inherited genetic mutations such as BRCA or BRCA mutations, Lynch syndrome, some of the newer mutations, PALB2, CHEK2, ATM, that are known to cause increased risk of cancer. And so we've known for years that there is a loophole, I guess, in some of the laws that protect people against discrimination. And that loophole allows certain insurers, including life, long-term care, and disability insurance, to either deny coverage or significantly increase rates.
That's Lisa Schlager, Vice President of Public Policy at an organization called FORCE, Facing Our Risk of Cancer Empowered.
So it can be a heavy financial burden. The tricky thing is, especially for folks in our community, is we know we're higher risk and we're doing everything we can to stay healthy. But if we can't get life insurance, then if we do get sick, it's even worse because we've not been able to secure policies to help protect our families should we unfortunately not survive a cancer diagnosis.
However, today you don't have to go through your doctor or healthcare provider to get a genetic test. Anyone can buy a direct-to-consumer genetic test at a cost that's come down significantly, only a few $100s, and the results remain private. They don't go to your medical record, and that concerns life insurers. You may know you have a chance of dying young, but they don't. Patricia Bourne.
If they can't have that information, then they might have to assume that people who are showing up to buy life insurance have shorter life expectancies than they would have anticipated. And that means that it could end up raising the rates for everybody because they'll have to make an assumption rather than know that we're insuring some people that are going to live till they're 80, a normal lifespan, more or less. You have accidents and you have some people that obviously live longer than that. But if there's an increasing number of people in this pool of people buying life insurance that know that they're all going to die sooner, the only response insurers can make to that is to then assume that they've got a share of those people in their pool and charge everybody a little bit more. Again, not to penalize them for the risk, but to make sure they have enough money to pay the claims as they come in.
But Schlager says this tactic of flying under the radar is necessary because if insurers have the information, they'd discriminate against just about everyone.
It is discriminatory to sort of go after the community that's been proactive to try to find out. I think every family, again, has it's either heart disease or high cholesterol or high blood pressure or Alzheimer's or, very few people have no family history of disease. And so it is an interesting dynamic now that we have this ability to zero in on, what causes these risks. That information is turned against the individuals. I actually, in some ways, think the opposite is true, that most people who get this information use it to take steps to try to stay healthy. So they're going to pick up their cancer screening regimen so that if, in fact, they are diagnosed, they're going to be diagnosed at an earlier stage when it's more easily treated and curable. Alternatively, they're going to opt for prophylactic or risk-reducing surgeries that reduce their risk to the point where it's even lower than the general population.
Schlager says a woman who gets a preventive mastectomy has only a 5% risk of getting cancer, while the average woman has a higher risk. Cases like that are why many people in the hereditary cancer community believe they are often a better risk for insurers than the general population. Prince says nobody can perfectly predict outcomes based on genetic information.
Genomics is new, and we're learning a lot about it, but we're not perfect. We don't know everything about the genes. And so one of the worries is that, somebody might be denied life insurance or be charged a higher premium based on data that 5 years later we learn something new. That could be true of all medical information, though, right? The things we know about cancer today are going to change 5 years from now. The things we know about heart disease in general, not just the genomic causes of heart disease, are going to change. So part of that cat-mouse game is science is always trying to get best at predicting risk, and so are insurers. So it's really important for insurers to understand the science and understand the uncertainty of the science. And that's one of the debates is what point should they be able to use that information?
Schlager is in conversation with federal and state legislators. However, her advocacy group has not met with insurance stakeholders. But if oncologists, geneticists, and insurers study the data and discuss the issue together, Schlager believes they may find better solutions.
What's interesting is we've really only been testing for probably a little over 20 years. So this is all somewhat new, and the most well-known mutations are the BRCA mutations. Some of these newer mutations we still don't know enough about, but we have a fair amount of data for BRCA mutations to be able to say, for those who test, here's what we know. And I think it would be really good for us to collect some data and see what the outcomes are and see if we might work with the insurers to figure out a way that we can offer some sort of peace of mind to individuals who carry these mutations, that they can get coverage if they need it.
And even if someone isn't all that worried about life insurance, Schlager says learning you carry a genetic mutation is still emotionally and financially stressful.
Because we incur a lot more costs for screenings that don't necessarily have to be covered under health insurance. So this is just one more area that adds to that stress. Worried that family members are affected, worried that children are affected, continually monitoring for cancer. So if there were some way that we could sort of eliminate that extra worry and somehow that we're penalized for something we have no control over in a lot of ways, other than trying to do our best to avoid disease, that would be fabulous. I think the members of the hereditary cancer community would take a big sigh of relief.
It's a complicated issue that affects the lives of millions of people. Hopefully, open-mindedness, compassion, and focus on the facts may alleviate some of the difficulties experienced on all sides: insurers, the insured, and the denied. You can learn more about all of our guests by visiting our website, radiohealthjournal.org. Our writer-producer this week is Polly Hansen. I'm Reed Pence. Coming up next week on Radio Health Journal,
you can see that he's stuttering, and you can also see that he's just doing whatever he can in the moment to get out of that moment of stuttering.
the fear of stuttering.
Then, why your grandparents' preference for junk food may make a difference in whether you get heart disease.
It's a kind of biological memory that's etched on reproductive cells.
All that and more on Radio Health Journal.
And that's Radio Health Journal for this week. Radio Health Journal is a production of MediaTrax Communications. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.